Hepatitis C is a viral infection that affects the liver, caused by the hepatitis C virus HCV. It can lead to both acute and chronic liver disease. Hepatitis C is a major global health concern due to its potential to cause long-term liver problems, including cirrhosis and liver cancer. Transmission: hepatitis C is primarily transmitted through blood-to-blood contact, sharing needles, using contaminated needles or syringes, commonly among people who inject drugs. Blood transfusions, receiving blood products that were not screened for HCV, though this is rare in countries with rigorous blood screening. Organ transplants, receiving organs from an HCV-infected donor. Healthcare settings, improper sterilization, using contaminated medical equipment or procedures. Sexual contact. While less common, the virus can be spread through sexual contact, especially with multiple partners or in the presence of other sexually transmitted infections. From mother to baby. An infected mother can't transmit the virus to her baby during childbirth, though this is less common. Tattooing and piercing. Using non-sterile equipment for tattoos or body piercings. Symptoms: hepatitis C symptoms can vary widely and may not appear for years. Then they do occur. They may include acute hepatitis C, jaundice, yellowing of the skin and eyes, fatigue, unusual tiredness or weakness, abdominal pain, especially in the upper right side of the abdomen, nausea and vomiting, feeling sick and possibly vomiting, loss of appetite, reduced desire to eat, dark urine. Urine may be darker than usual. Light-colored stools. Stools may be pale or clay-colored. Chronic hepatitis C. Many people with chronic hepatitis C do not experience symptoms until the liver is significantly damaged. Symptoms can be similar to those of acute hepatitis C but are often less noticeable until the disease progresses. Diagnosis: hepatitis C is diagnosed through several methods. Medical history and physical examination. Review of symptoms, risk factors, and possible exposure to HCV. Blood tests. HCV antibody test. Anti-HCV detects antibodies to the virus, indicating past or current infection. HCV-RNA test measures the amount of virus in the blood viral load to confirm active infection and monitor response to treatment. HCV genotype test determines the specific strain of the virus, which helps guide treatment decisions. Liver function tests to assess liver damage and function. Liver imaging, ultrasound, CT scan, or MRI, to evaluate liver condition and detect complications like liver cirrhosis or tumors. Liver biopsy or non-invasive fibrosis assessment. Liver biopsy, to assess the extent of liver damage, though less commonly used now due to non-invasive methods. Fibroscan or elastography measures liver stiffness to estimate the degree of fibrosis or cirrhosis. Treatment for hepatitis C has advanced significantly in recent years, and most people can now be cured with direct-acting antiviral DAAs. Treatment approaches include direct-acting antiviral DAAs. Medications: drugs like sofosbuvir, levetiracetam, docetaxel, and velpatasvir are used to target the virus directly. DAAs are highly effective and typically result in a cure. Combination therapy. Sometimes, a combination of DAAs is used depending on the genotype of the virus and the extent of liver damage. Lifestyle changes. Avoiding alcohol, reducing or eliminating alcohol intake to prevent additional liver damage. Healthy diet. Eating a balanced diet to support overall health and liver function. Monitoring. Regular follow-up with blood tests and liver function assessments to monitor response to treatment and liver health. Prevention. Preventing hepatitis C involves several measures. Safe practices. Avoid sharing needles. Use sterile needles and syringes if injecting drugs. Safe medical practices. Ensure that healthcare providers use sterile equipment. Screening. Blood donations. Blood products are screened for HCV in many countries, reducing the risk of transmission. Safe tattooing and piercing. Ensure that tattoos and piercings are done with sterile equipment. Prognosis: acute hepatitis C. The majority of people with acute hepatitis C recovered fully without the need for treatment. However, in some cases, the infection can progress to chronic hepatitis C. Chronic hepatitis C. With appropriate treatment, most people with chronic hepatitis C can achieve a sustained virologic response (SVR), meaning the virus is undetectable in the blood and the person is considered cured. Early diagnosis and treatment are crucial to prevent severe liver damage, cirrhosis, and liver cancer. Conclusion: hepatitis C is a serious viral infection that can lead to significant liver damage if left untreated. Advances in treatment have made it possible to cure the infection in most people. Prevention through safe practices and regular screening, combined with effective treatment, can help manage and reduce the impact of hepatitis C. If you suspect you have hepatitis C or are at risk, seeking medical advice for diagnosis and treatment is important.